Let's test your knowledge on EKG strips. Okay, the first strip is this one. Does anyone know what this is? This is atrial flutter. We know this because the rhythm is regular, but we don't really have any P waves. How about this strip? The rhythm is irregular and the P waves are absent. This is atrial fibrillation or AFib. A lot of students get these two mixed up, so I'm going to tell you how you can notice the difference between atrial flutter and AFib. The main difference here is that AFib has irregularly irregular R-to-R intervals. You can see how there's a big space here, a small space here, a small space here, and a big space. They're irregularly irregular. Where atrial flutter typically, not always, but typically has regular R-to-R intervals. They are nicely aligned and spaced out. Another silly way to remember this is to think of this as an A and this as an A because they kind of look like A's. And you can think A, flutter, 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 A, flutter, 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 A, flutter, flutter, flutter. The flutters are kind of more pretty looking than in AFib. Now, in AFib, these do look like A's as well, but we have A, fibbing, 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 A, fibbing, fibbing, fibbing. They kind of look more irregular versus our nice little fluttering here in A flutter. So now hopefully you can tell the difference between atrial flutter and AFib. Okay, this is the next strip. Does anybody know what this one is? This one is ventricle tachycardia, VT or VTach. The characteristics here is that we have irregular coarse form waves of different shapes. This is a very, very fatal rhythm with no contraction and no cardiac output. You can kind of remember this one because it kind of looks like a tombstone, and VTach is again very deadly. Okay, this is our next one. Does anybody know what this one is? This one is asystole or flatline. In asystole, we have no heart rate, no rhythm, no P waves, and no QRS complex, which is why it's called flatline. If you remember your medical terminology, A means without, and systole means the heart muscle is contracting. So asystole means we have no heart contraction. Does anybody know what this strip is? This one's a little tricky because here we have a nice PQRS complex, and then we have this weird thing that's going on. We call this PVCs or preventricular contractions. It's an early or premature conduction of the QRS complex. Occasional PVCs are harmless, but if we have frequent and consistent PVCs, that's when it becomes an issue and actually can lead to deadly rhythms. It's important to note there are a few different types of PVCs. Bigeminy, which happens every other beat. Remember, bi means 2. Trigeminy means 3, so this PVC happens every third beat. Quad means 4, so quadrigeminy is a PVC that happens every fourth beat. Okay, last but not least is this strip. Does anybody know what this is? Well, at first glance, we have some really nice PQRS complexes that are nice and even. And we have a normal looking strip, but the rhythm is very slow, making this sinus bradycardia. Brady means slow, so we have a slow heart rate. If you want more help understanding EKG strips, you can find all this information and more in the complete nursing school bundle. Happy studying, future nurses!